Here is a detailed overview of pyridoxine, vitamin B6. 1. Generic name, drug class, drug forms, brand name. Generic name, pyridoxine, drug class, vitamin B, specifically vitamin B6. Drug forms, oral tablets, capsules, extended release tablets, liquid injectable solution. Brand names, Neurobion with B1, B12, Nestrex B6, Pyri B, Vitamed B6. 2. Definition. Pyridoxine is a water-soluble vitamin essential for protein metabolism, neurotransmitter synthesis, red blood cell production, and immune function. 3. Mechanism of action. Pyridoxine is converted into the active coenzyme form pyridoxal 5-phosphate, PLP, which serves as a cofactor in enzymatic reactions including amino acid metabolism, neurotransmitter synthesis, e.g. serotonin, dopamine, GABA, gluconeogenesis, and lipid metabolism. 4. Indication. Pyridoxine deficiency, isoniazid or hydrolysine-induced neuropathy, morning sickness in pregnancy, homocystinuria, sideroblastic anemia, seizures due to deficiency, especially in infants, adjunct in certain metabolic disorders. 5. Contraindication, known hypersensitivity to pyridoxine or any formulation components. Before taking this medicine, precautions. Inform doctor if pregnant, breastfeeding, or having kidney or liver disease. Caution with long-term or high-dose use due to risk of neuropathy. May interact with other B vitamins or medications. 7. How to use. Take exactly as prescribed. Can be taken with or without food. Do not crush or chew extended release forms. 8. Dosing information. Mild deficiency, 10 to 20 milligrams per day. Severe deficiency, up to 100 milligrams per day. Isoniazid-induced neuropathy, 25 to 100 milligrams per day. Morning sickness, pregnancy, 10 to 25 milligrams 3 times a day, under medical supervision. 10.9. Miss a dose, overdose. Miss a dose, take as soon as remembered unless close to the next dose. Don't double dose. Overdose. High doses, 500 milligrams per day, may cause sensory neuropathy. Seek immediate medical attention. 10. Stop or avoid taking. Stop only under medical advice. Avoid megadoses unless specifically prescribed for certain conditions. #11 side effects. Common: nausea, headache, drowsiness. Rare: peripheral neuropathy with long-term high doses, photosensitivity, sensory ataxia, irritability, liver enzyme elevation. Rare. 12. Vital information. Pyridoxine is essential for proper nerve function and amino acid metabolism. Long-term high doses, 200 milligrams per day, can cause irreversible nerve damage. Water-soluble, so excess is usually excreted, but chronic high use still risky. #13. Other drugs will affect. Decrease pyridoxine levels. Isoniazid, hydralazine, penicillamine, levodopa when given alone. Pyridoxine may reduce efficacy of levodopa unless combined with carbidopa. Thank you. Have a nice day.